Good morning or good afternoon, depending on what time zone you happen to be in at the moment. By way of introduction, my name is Norah Naughton, and I am the Senior Associate Chair for Education and Professionalism and the Program Director for the Anesthesiology Residency at the University of Michigan. I have been the Program Director for about 8, going on 9 years, but have had a fantastic career as an academic anesthesiologist at Michigan that I would describe as clinician, educator, administrator. I'd like to thank the FAIR leadership for this opportunity to discuss tips for applying and matching to residency with all of you. And the process of applying and matching can absolutely seem like trying to solve a puzzle that seems like a mystery, both for program directors and for the applicants. And it can seem that way, but you're made up of different sort of puzzle pieces, and there's different kinds of puzzles to solve. And so before I get into my tips for applying to residency, I do want to talk about 2 recent dynamics in the undergraduate medical education arena that will probably impact that transition from undergraduate to graduate medical education when all of you go forward into what I think will be Match of 2023. And some of these changes are quite new, and they can seem like this one big change is swimming against a history of resistance. But the seeds have been planted, some are actually sprouted, and more will definitely continue to be seeded. So 2 that I want to mention. One is the decision made by the stakeholders at the Invitational Conference on USMLE scoring, deciding to change the step 1 3-digit score to pass-fail. That was a huge decision and has the UME to GME program director conversations kind of turned on its head. And also in the summer of 2020, a coalition for physician accountability, again, stakeholders interested in the UME to GME transition, met and talked about the stress, the anxiety, and the strain associated with this transition, both for applicants and for program directors, and came up with 42 what is called blue sky recommendations to really start to focus on this transition going forward. And I encourage all of you to at least be aware of this document, possibly and be engaged in moving forward some of the recommendations, and even potentially some scholarly activity around these initiatives. And finally, virtual interviewing that concluded for the first time in Match of 2021 absolutely turned out to be the mother of invention. Lots was learned during that interviewing process, both by applicants and program directors. And honestly, I really don't think that interviewing is going to go back to the historical in-person process that was years and years in the making. And I'll talk a little bit about that in just a bit. So what are the application components when you're considering applying to residency? Well, you can see them here. Of course, pre-COVID, so to speak, scores, transcripts, dean's letters, they all sort of had some quantification associated with them, sort of indicating top quartile, middle of the class, or lower quartile. But now those 3, shall we say, application components are fading a little bit more into the background. As I mentioned, USMLE Part 1 is pass-fail, although Part 2 will remain scored. More and more medical schools are going to pass-fail for rotation grades, and more dean's letters are not ranking students. And this has program directors really concerned, really asking undergraduate medical education leadership, what can we look at to try to better understand the candidacy of any particular medical student? And so that brings letters of recommendations and personal statements more into the forefront, which brings me to my first tip for applying to residency, and probably the one that I really want to emphasize the most, which is this. Try to understand what intrinsically motivates you to all throughout medical school, and to especially, hopefully, anesthesiology, and be quite deliberate with your choices as you go through medical school. Because ultimately, you are sewing the fabric of your narrative that what is driving you to pursue a particular specialty or a particular residency, and that's going to be unique to you. So for example, all of you pursued and were accepted into the research scholarship opportunity for medical students through FAIR, and that is fantastic. Congratulations. So when you look at residencies, you would likely, hopefully, look at it through the lens of how can I continue to gain experience in research and possibly move towards my career as a physician scholar. So I'll just use Michigan's program for one example. You would look at the content of the residency and see that the department is #1 in NIH funding, that there are opportunities to do research during training, that there is very energetic and robust multidisciplinary collaborative research going on within the department, and that data science is a very robust scholarly area of the department. And likewise, as an example, at Washington University School of Medicine, there are 2 resident tracks that provide some great opportunity to continue to develop your sort of research skills and knowledge as you continue to move towards maybe a career as a physician scholar. These are the Washington's University Scholars Program and the Academic Scholars Advancement Program, or ASAP, which is a 5-year program. So some other tips that I want to put out there to you is to know your geographic interests. Medical students every year rank that location was the #1 reason for ranking a program in the top of their list. If you have no intentions of moving to where the program is, do not interview at that program. You have to pass standardized exams. Right now, it's a little in flux. I would encourage everybody to do well on exams, but you absolutely at least have to pass them on first attempt. And then finally, the virtual interviewing, shall we say, push that all program directors and all programs and applicants, had to do last match really got programs really looking at their websites critically. And you will find a lot of granular, really good information about programs now. Their pillars, which are typically in the discovery, education, patient care service pillar, and also really get to feel about, well, what are these programs' aims, this particular residency, programmatic aims and strengths. And program directors will expect you to know a little bit more about their program, both through your application process and should you get an interview and possibly match. So what about anesthesiology residency programs as of 2021? Well, graduating medical students can apply for either categorical or advanced positions, and there are 159 categorical programs and 57 advanced programs as of 2021 with the corresponding positions. And when you finally get to that point of entering into the match, I want you to take a deep breath. It is highly likely that you will match. The data just bears this out. And in particular, if you're a senior MD or you're a senior DO student, you have a very good chance of matching in your top 3 ranks. So I do encourage you to just take a breath and be confident that you will make it. But what I can't tell you is what the interview experience is going to be like. I doubt it will go back to fully in person. It's hard to know if it will stay fully virtual. I suspect that will be the case for 1 more year. And I suspect that something that we don't even know about is going to pop up and fill the space, some sort of hybrid model between those 2. But having said that, the National Resident Matching Program did survey applicants and program directors on this past virtual experience. And both of those groups were agreed that there were some good things about it. It was efficient, it was cost effective. As I mentioned, programs enhanced the content of their websites. Applicants interviewed more, programs interviewed more applicants, but at the end of the day, 75% said it really had very little impact on their rank order lists, and the match was successful. However, both agreed there weren't so great experiences associated with virtual interviewing. program directors had limited understanding of the applicants' motivations, and applicants had limited understanding of the culture of the program, the philosophy, and the inclusivity. And what is that? That's the people pillar. And that is pretty vexing and remains a little bit elusive in the virtual environment. And so what I would recommend you consider if it stays virtual is to really engage as much as possible for every opportunity that you can to learn about the culture, community, the collaboration, the connection that's possible. Because what this is really saying to me as a program director is that the applicant is saying, what is the clinical learning environment like? Because that is how I'm going to stay well when I embark on this really, really hard future of mine called residency. And also applicants talked a lot about not having a great feel for the focus on diversity, equity, and inclusion. And I do want to say that there is an amazing collaboration going on between the Departments of Anesthesiology at Michigan and Washington University called RADAR, which is Raising Anesthesiology Diversity and Anti-Racism. And this is a deliberate focus to aim to recruit, connect, and develop a diverse community of academic anesthesiologists. I encourage all of you to visit our website and look at what RADAR really is, because it has the potential for also scholarly work. And if you are interested in a program and we're in a virtual environment and you need or you want to look to understand as much as you can about the people pillar, attend virtual open houses, as many as you can. I would engage in social media, but limited. I would engage in the social media associated with the program or maybe the residents of that program. But my strongest recommendation is to find the contact information of residents that are currently in the program, or contact your medical school administration as to how you can contact recent medical school graduates in the programs that they matched into that you're interested in. And you will get a pretty strong sense of the learning culture of that particular program through current residents. And so finally, I want to end on what is, I'm going to call that holistic portrait that I'm encouraging you to really reflect on, be deliberate about in your choices, and have that portrait be able to be communicated to program directors. Because the question that program directors have is, what is your passion that is fueling you to pursue not only the specialty, which I'm hoping for all of you is anesthesiology, but also their program? And just to sort of highlight this, that this might be coming more and more in the forefront, this holistic sense of the applicant is a pilot between several obstetric gynecology residencies where they are utilizing Casper Suite for graduate medical education. And what that is the use of certain tools that are developed and run by Altus Assessments. And it provides perhaps some information for programs to assess and understand the candidate's alignment to their program, to give the candidate opportunity to showcase their communication skills, their non-cognitive skills, such as empathy, ethics, and professionalism, but finally, aid in the developing a holistic understanding of you as an individual applicant. I want to point you to some resources when you're ready to sort of look at residencies and where they are in this country. The National Resident Matching Program is a great content source for that, as well as FRIDA, that is sponsored by the American Medical Association. The data is imperfect for the question of how competitive is a residency. It's imperfect, but I would point you to the US News and World Report annual ranking report of residencies, and also Doximity. And I mentioned social media and using limited networking for programs that you are potentially interested in. And finally, reach out to me. I am passionate about coaching and advising and medical students as they steer their way through the application and matching process. And my information is here, as well as some social media associated with our program here at Michigan. So thanks so much.